Welcome back to Upstate Living, and thank you for joining us as we head to the doctor's desk with Albany braces. If you're a parent with a young child who hasn't yet been to the orthodontist, this is going to be a great conversation to tune in for.
Yes, joining us now to tell us about the importance of an early ortho evaluation is our good friend of the program, Dr. Olivia Turner. Good morning.
Good morning. Thank you for having me back.
The best smile in orthodontics.
Yes.
Here she is on Upstate Living. So this is a great conversation because we're focusing on that first visit, right? So you recommend maybe at the age of 7, a youngster comes in, gets checked out, gets the evaluation. Can you tell us more about why that's the good age and why that's the time to come in and see you?
Yes. Age 7, dentally, you have some adult teeth coming in, lots of baby teeth still present. Kids are growing and developing, a lot is changing, a lot is happening in the mouth, and most children won't need any treatment at this time. But for some children, there's issues that if we can address them and handle them at that age, you set up a very good framework for growing and developing over the remaining years of growth.
Cool. Right off the rip, get into it. Yeah.
I love knowing as a parent that age 7 is when you should start paying attention to the teeth to see if they need some fixing. Should a parent expect a referral from their dentist to come to you, or should they just kind of pay attention on their own and give you a call?
Wonderful question. There's lots of wonderful dentists in the area that are very good at referring their patients to have us see them for an evaluation, but we also are always happy to see any child at that age, and we are very good about sending back communication to the dentist, letting them know what we think, and treatment planning along with them.
I'm going back to myself as a kid. I remember being a little afraid of the dentist, the doctor, going to the orthodontist, but with the new technology that you have, this whole process is very seamless and the furthest thing from intimidating, correct?
Yes, I think a lot of children first come in, they think it's going to be something scary, and we have a lot of tech that we use. We have like scans, so people think about these goopy impressions that they used to have, their parents had when they were kids. Technology has changed. It's a pretty straightforward and seamless process, and I think a lot of children over their time at our office actually grow more and more comfortable with like overall the dental experience.
Yeah.
We're a pretty warm, welcoming place, and we create a good patient experience.
Good stuff.
You are a warm person.
Yeah.
We love you.
I love when you're here. It's so great.
It is awesome. And when kids come in, I mean, what do you do to make, because they can be afraid, it can be intimidating. How do you help calm them down when they come in?
I think the biggest thing for anyone, not just children, is the unexpected, so not knowing what to expect. And I think along with my team, I have a pretty incredible team, are very good at like educating people, letting people know what's coming at the next appointment, what to expect that day. This might make weird noise, but it doesn't actually hurt, and letting people know about things. I feel like that is what makes people comfortable, and over multiple appointments, you start to realize that, okay, I can trust that they're going to let me know about anything coming down.
I wish I was a kid and I was coming to see you, because whenever you come to our studio, it's just like the most vibrant, positive vibe.
Thank you.
This is where it's at.
Thank you.
You know, so if a kid does come in and you realize like, hey, they might need some work, they might need some help, what are kind of the first things that you would do? I assume they're not going to get braces right away, but are there like palate expanders, or what could be like the first thing that goes in there?
So when you start talking about kids around like age 7, the most common appliance we put in is palate expanders, which are just these appliances that slowly widen jaws. When you're that age, you're growing, you're changing, your bones are very elastic and malleable, so it's a very simple process to widen things. As you grow older, things, you know, harden, fuse, that kind of thing, and it's less easy, so that's why we do it at that age.
Makes sense. Cool.
What else should parents know that believe their child may need braces?
Like different issues to look for?
Yeah.
So if you see your child and they have lots of crowding, like their teeth are kind of coming in all over, there doesn't seem to be enough room for them. Kids have cross bites, which is where teeth fit on the wrong side of other teeth. And sometimes you have like family histories of jaw discrepancies, like underbites and that kind of thing, all things to look for and all reasons to come in. But like I said, even if you're not sure, you don't know what to look for, just stop in, because I'll never recommend treatment unless I think there's treatment to be recommended. Otherwise, we just keep an eye on kiddos and watch them grow.
You're the best, Doc. We appreciate you so much.
Thank
Again,
you.
the vibe is always on like 20 when you come in here. We don't need the level of 10. It just boosts right up. So
beyond.
Yeah, thanks for all your wisdom and your positivity, and of course, bringing that sweet smile to Upstate Living.
Thank you guys so much for having me.